Hi, I'm Dr. Roy Picard, DC, and I want to welcome you to Michigan Integrative Health. Many people are not aware that we actually have three different types of services when it comes to chronic joint pain in the back, knee, hip, and shoulder. Most, if not all, of the offices that you've been to were limited in services that they could provide as a result of the type of the license of the doctor, and also because of the fact that they choose to follow those strict insurance guidelines, which limits their ability to offer the best care when it comes to chronic joint pain. Now, we have some other videos on the topic of three components of chronic joint pain, but for now, just be aware of all of the diagnoses ever involved in chronic joint pain of the back, knee, hip, and shoulder will involve three things. It's inflammation, joint instability, and tissue damage. Michigan Integrative Health was designed to address those three different components without having any of the restrictions that most other offices will have as a result of the scope of practice, and again, those insurance-based guidelines. Now, since we have providers of different professions, we are able to take chronic joint pain care to a whole new level. So in this first of three videos, I'm going to focus on the joint stability care that we offer. When it comes to chronic joint pain, it's extremely important to get the joint stabilized in order to resolve the pain and stop or at least slow down degeneration. This type of care involves putting the joints, such as the back, knee, hip, or shoulder, into different positions in order to isolate the different muscles involved in the joint, either directly as well as some of the muscles that are involved indirectly. And this is being done while applying a specific amount of pressure, which will result in the joint becoming more stable, better coordinated. There will be an increase in motion, increase in strength, and it can immediately decrease the pain. This does not involve any joint manipulation. It's not the traditional chiropractic adjustments with the bone cracking or things like that. Now, of course, it's wonderful when the pain is immediately reduced, but you have to look beyond that, because once the joint becomes stable, then you will no longer have destruction to the tissues of the joint, like the muscles, tendons, ligaments, and cartilage, and perhaps, let's say, the disc if we're talking about the back, the meniscus if we're talking about your knee, rotator cuff if we're talking about the shoulder, and labrum in the situation of the hip. This is how arthritis and degeneration and basically wear and tear can occur in the back, knee, hip, and shoulder. And you really need to think about this because many people have been talked into symptomatic treatment of their pain only while not getting the joint stabilized. For example, you may have been told that you need a cortisone shot or take a pill, put a patch on it. Go ahead and use this electrical device on it, and then 5 or 10 years later, you don't understand why that you're being told now that you need surgery or joint replacement surgery. And by the way, what do you think happens when we test the people who are bone on bone with this type of service? Probably 60% or higher are still getting the benefits of what we have to offer, which then proves that the bone on bone is not always the cause of the pain. That's why you hear so many people say that they, were no better off after they had replacement surgery. Now, I also want you to think about that we test this on your initial visit to confirm that we can help you. If you are one of the 10% of the people that we test that do not notice an immediate improvement in range of motion, strength of the joint, or even decreased pain of the joint during your initial visit, then we will not have you come back to the office for care. We see approximately 90% of the patients, however, on their initial visit will experience a positive change during the assessment. Now, once you go through this experience, you will then have the confidence knowing that we are going to be able to help you, and you're not going to have to worry about wasting time going to some office 2 or 3 times a week and waiting 3 or 4 weeks to see if it's going to work or not for you. So let us prove to you that during your initial consultation, exam, x-rays, and assessment that we can help you. With this type of care, we are normally going to resolve this matter in 8 visits or less. That means you get your life back and no longer feel like you're wasting time with endless visits to doctors' offices. Be sure to watch part 2 and part 3 of this series, where you will become exposed to information that most people have never even heard of, and you're going to learn about care that you may need that is not even available through the doctors you've previously seen.